always moving on to our next topic,
Yeah.
blood deficiency. So it's not necessarily anemia. Again, this is the beauty of Chinese medicine. What are we doing? Interconnecting things, seeing how things relate, but catching things before they get really serious, hopefully. Otherwise, it's already too late, and then they have a more serious condition where they are going to a Western medical provider. They have a Western medical diagnosis, for instance, of anemia. But in Chinese medicine, we'll see blood deficiency symptoms before it actually turns into anemia. Question?
No.
No? Okay, good. So something that people get a little confused about is like, what do you mean by it's deficient? Is it the quantity of the blood? Quality of the blood? Could be either of these. So you may have the right amount of volume, but the quality of it, it's like nutrient composition, if you will, isn't as strong as it could be. Or perhaps the quantity is also low.
Do you treat differently based on those two things?
Nah,
Yeah.
doesn't. Yeah, same treatment. You still nourish and generate blood regardless. Yeah. For the skin, what you'll see is dry, pale skin, because the blood will nourish it, and when the blood is deficient, you see paleness, right? Like you don't have that flush face or whatever it is.
Isn't the lung controls the skin?
The lung controls the skin, but the blood nourishes and moistens the skin.
So if you have a dried or pale skin, it could be a blood deficiency as well as this
lung yin deficiency. However, if it's a lung yin deficiency, are they going to be hot or cold? Hot, because there's too much yang compared to yin. Okay, so they're too hot. So are they going to be pale or are they going to be red and dry? So if it's a lung yin deficiency with heat, is it going to be dry and pale or dry and red?
Dry and red.
Dry and red. So that's the difference, right? Pale and red, blood deficiency. I mean, pale and dry, blood deficiency. Red and dry, yin deficient heat. And then different organs can be more affected. Heart blood deficiency, we talked about this. Sleep issues. Difficulty falling asleep, particularly. Liver blood deficiency, women could have amenorrhea, where they don't have a menstrual cycle, or they could have scanty menses, where the amount of the menstrual cycle is low. You have the muscle spasms at night that we talked about. Other symptoms could be pale, brittle nails. The nails are considered an extension of the sinews or the tendons, which we talked about are related to the liver. Right? So you'll see like dry and cracked nails, or not dry, cracked and pale nails. Or for instance, the quality of the hair will look dry and lackluster because the liver blood nourishes the hair.